Hi, my name is Lindsay and I'm one of the pharmacy interns here at Mass General Hospital. The purpose of this video is to provide you with an overview of the medications used to prevent infection, as well as the use of supplements after transplant. Like I mentioned in my previous videos, you will be taking a number of new medications after your kidney transplant. And because your body will not be able to fight off infections very well, you have to be taking anti-infective medications. And in addition, you will also be likely taking other medications to prevent or manage side effects or treat other chronic conditions you may have. So, why do you need anti-infective medications? Well, you are at higher risk of infection because of the anti-rejection medications, which will be used to suppress your immune system, which means that you'll be more vulnerable to infections. And anti-infective medications will help prevent those infections after your transplant. But these will only be temporary, so it'll be anywhere between 3 to 6 months to 1 year, dependent on your specific medical history. We typically send all transplant recipients home with at least 2 types of medications to prevent general infections and pneumonia. These are specifically medications to prevent bacterial infections and viral infections. The first medication to prevent infection is called Bactrim. Bactrim is used to prevent bacterial infections. You should take this medication for 6 months after transplant. The most common dose is 1 tablet every day, although this changes with your kidney function. Bactrim makes you more sensitive to the sun, so it is important you wear sunscreen whenever you go outside. If you have a sulfa allergy, you may be taking either dapsone or atovaquone instead of Bactrim, and the stop date will be written on your medication card. The second infection prevention medication is either Valsite or Famvir. Valsite and Famvir prevent viral infections after transplant. The choice of agent depends on your exposure and the donor's exposure to a common virus called CMV. Valsite is most commonly taken once a day, although this dose changes based on your kidney function. You will take it between 3 to 6 months after transplant. Famvir is also once daily, although the dose may change based on kidney function. You will take this medication for 3 months. Both of these medications are well tolerated, and the stop date will be written on your medication card. The main take-home points is that you will be taking medications to prevent different types of infections, and these medications are usually temporary. In addition to your infection prevention medications, most patients are sent home with a medication to prevent stomach ulcers like omeprazole, also known as Prilosec. Omeprazole is typically taken 1 a day and will be continued for 1 month after transplant or until your prednisone dose decreases to 5 milligrams daily. On the other hand, famotidine will be 20 milligrams once or twice daily, and it'll also be continued for 1 month after transplant or until your prednisone dose decreases to 5 daily. And these 2 medications are both well tolerated. After your transplant, it is important to tell all of your healthcare providers that you are taking anti-rejection medications. This is important because a number of other medications can potentially impact the way your anti-rejection medications work in your body. For example, some medications can increase the levels of your anti-rejection medications, causing toxic side effects, and others may decrease them, increasing your risk of rejection. And this is why it is important to let your transplant coordinator know about any new medications that other providers may want you to start. We recommend against the use of herbal products after transplant due to the interactions and oftentimes immune boosting effects, which could increase your risk of organ rejection. Make sure to double check with your transplant coordinator or transplant pharmacist before taking any over-the-counter medications. As a reminder, it is important to avoid grapefruit or grapefruit-containing products since it interacts with your transplant medications. These are the most commonly used supplements that are considered safe. If you would like to take a supplement not listed here, please check with your transplant coordinator or transplant pharmacist. After transplant, we recommend only taking Tylenol or acetaminophen for over-the-counter pain medications. We recommend not exceeding 3,000 milligrams in 24 hours. It is important to also avoid the following OTC pain medications listed here because they could be harmful to your kidneys. The main take-home message is that most insurance companies do not cover these over-the-counter products, and you want to buy the OTC products that are recommended by your transplant team. Make sure to use the handout in your binder as a reference for safe and unsafe OTC products. And as always, if you have any other questions regarding the safety of OTC medications, please speak with your transplant pharmacist or transplant coordinator. Thank you.